kind of feedback have you had from people who've been using the app regularly?
Yeah, it's been great. I mean, so far we've done over 35,000 queries with customers. I mean, South Africa, we've got over 180,000 customers, paying customers. We've got a bigger number of free customers. And Indonesia, in Indonesia, we've just launched and we've gone over 20,000 in 6 weeks. And the response is very, very positive across the board. So in Facebook, you get free and we get fantastic feedback. It's really interactive. So we've got a big South African user base of 200,000 fans, and they interact hugely on it. And then the feedback from customers who are asking questions and getting advice from doctors has been very empowering.
Yeah.
You know, it's quite interesting is in emerging markets, because the healthcare systems are constrained, the healthcare workers are overrun. So there isn't a soft, gentle environment that people walk into when they're sick. You know, it's a pressurized, stressful environment. They don't typically get treated with enough respect or with enough dignity. Now all of a sudden people who have never had access to private sector doctors are being given a wonderful experience, even though it's from a distance. And that we often get feedback that says, I can't believe how respectful the doctor was in treating my concern. And I think that's a fantastic reality that what we're saying is we know we can recruit, train and empower doctors to give service, and they're giving that service largely to people that have never had access to private healthcare in their lives. And that's in South Africa, and it's going to have even more of a impact in Africa, where there's even less resource, and in Indonesia, where they're even more challenged because of geography and lack of resource at the same time.
As a very practical example, we do little dipstick quality check measures, and listening to a conversation between one of our doctors and a patient, or a consumer, or a customer. And the doctor says to the customer, could you just step outside or move into a quieter environment? I'm really battling to hear you. The person on the other end says, I can't, I'm in a taxi. and for us, just the whole picture of how that revolutionizes healthcare in this country. Here's someone in the back of a taxi having a one-on-one conversation with a doctor, getting that dignity, getting that interactive personal healthcare feedback. It's just amazing.
Yeah.